Hi everyone, welcome to Center of Balance Live. I'm Sinan Pua from Center of Balance, the acupuncturist. Good morning, good morning, good morning. Right, hi Eric, how are you? Good morning. Okay, I'm just checking all my platform is on. Now today we're going to talk about PCOS treatment, polycystic ovaries treatment, and in acupuncture and Chinese medicine. This is what we're going to talk about. So I'm going to give you some point strategy in Dr. Tan's Global Balance. Okay, so good morning, Veronica. Nice to meet you. Thank you for coming, joining us. Thank you. Right. Now I'm going to show you female hormone in Dr. Tan's 8 magical for OBGYN, those 2 points, all right? So those are the things that I want to show you today, and I'm going to share with you. Then hang on, let me just create a watch thing in my Facebook. So please share your live video. Hi Hassan, how are you? Nice to meet you. If you could start a watch party, it would be great, because therefore more and more people will join in. Okay, so thank you. If you're on Facebook, Instagram, or YouTube, please say hello to me and give me a thumbs up and share this live video, please. Thank you. Now we all know about one thing in PCOS. Okay, it is about the hormone imbalance. Bless me. It's about the hormone imbalance, and the imbalance is one hormone is too much, the other one too low, right? That's what we call imbalance. What is balance? That is both even, okay, pretty good on the standard level. So which one is too high then? The male hormone, androgen, right? And what hormone is low? And that is female hormone, right? It could be LH, FSH, estrogen, right? Those are becoming low. Then now we have to have a strategy to in acupuncture to balance the hormone. That's why we have female hormone balance, those points. Okay, so let me see about Facebook. Yeah, Facebook you can see it properly, no problem, right? It seems like Facebook no problem, but the YouTube you see it differently. Okay, you can't see really the word, but so you want to prepare a pen and a paper so I can read it out. Hi Nida, how are you? I can read it out later on and you can write it down. Okay, those points, what point to use for PCOS. Okay, so yes, you want to prepare a pen and a paper to write some notes. Okay, what else? Put on weight. So women who suffer from PCOS, 70 to 80% of them actually put on weight. Right, so weight is the main issue, biggest issue in PCOS. Okay, so in the research and study, if you lose weight for 5 to 10%, and it will actually regular your period. You may miss your period, and it actually bring your period on again. So which when it comes to the diet, so even though we give you acupuncture, we give you Chinese herbs today. If you come for PCOS, diet is still the main treatment that everyone should do, everyone should follow. Now, if you're not quite sure what sort of diet, you have to go back to a few days ago on a YouTube, on a Facebook, go and get the video again and watch it again, what sort of diet that we suggest you should follow. And we mentioned the China study is a good book, so you should read it too. Okay, then to lose weight, not just diet, right? You can do a lot of things. Like exercise is one of the best things for losing weight. So if you can do a diet, exercise, that'll be great. It'll be great. Okay. Now, so in PCOS, in acupuncture treatment, I'm going to show you two point strategies. Okay. Later. Okay. But does it mean we only with those two you can treat everyone? You can fix everyone? No. We have more than two strategies. I'm going to just show you two strategies today. Okay. And then let's talk about, before we talk about the acupuncture point strategy, global balance, let's talk about Chinese herbs first. Okay. So the herbs, 桂枝茯苓丸, I don't know you already hear about it or not. It's a classic formula. Come from 伤寒杂病论, okay, 金匮要略. 桂枝茯苓丸 have 5 different herbs. 桂枝、丹皮、芍药、桃仁、丹桃芍、桃仁, right? 茯苓. 茯苓 is one of the herbs very good for what? For water, to passing out water. And why most people think that cis is all about we call yu. I don't know how to explain English. Yu is something that the water should keep moving, and it stopped there. It's not moving. Slow down, and we say this is yu. And we have two different things will stop there. It's slowing down and become yu. One is water, one is blood. When blood yu slow down or stop over there, it'll become clots. Clot issues. And the water yu, it will become mucus or dampness. Okay, those are the two things. Therefore, 桂枝茯苓丸 got 5 of the herbs. It has the 桂枝. Okay, the 桂枝 is actually a warming herbs. 桂枝 is a warming herbs. Why? Because when it comes to slow down, water and blood slow down, it actually, when it become cold, when you suffer from cold, and the blood and water slow down. Look at the river. The river, when the waters go, it go very fast. In summertime, when it's hot, when it's spring. When it comes to winter time, it's colder. It become ice. Those water go slower until they stop, completely stop when they become ice. Does it make sense? It's simple, just like the blood, the water in our blood. So in our blood is 60 or 70% of blood is made out of water. And our weight, our body weight is 60-70% is actually from water. Okay, therefore, to move the water, you need some warm thing, which is 桂枝. That's one thing. Second thing is fooling, passing out water. With the water stop slowing down and it become mucus or dampness, you want to pass it out, use fooling. Then the rest of it is moving the blood. So 桃仁丹皮芍药 move the blood itself. So those two things in 桂枝茯苓丸 is working very well. That's why 桂枝茯苓丸 is one of the most famous formula for PCOS, for polycystic ovaries symptoms. Okay, based on this formula, you can go and combine with other formula. With what? Let's say, well, this patient get diarrhea all the time, bloating, diarrhea, bloating, stomach pain, and feel heaviness, and a lot of teeth mark on the teeth, and then stomach and spleen weakness. What can you do? You can add on 桂枝茯苓丸 add on 参苓白术汤 or 六君子汤 or 理中汤, right? And some of them they have very stress, and it's very stressed with diarrhea. You can use 小柴胡汤 plus 桂枝茯苓丸, right? And or 逍遥散 plus 桂枝茯苓丸 or 单支逍遥散 plus 桂枝茯苓丸. That's simple. What if this patient have lower back pain, getting up at night time to go to the toilet, and have low libido? This is about kidney problem, right? Is it kidney yin or kidney yang? Or feel cold a lot, hands and feet are cold? Oh, this is kidney yang problem. So you use 肾气丸 plus 桂枝茯苓丸. Or if this patient have heat, got hot flusher, oh, we can use 栀柏地黄丸 with 桂枝茯苓丸. Does it make sense? Okay, so those are quite important to note of if you're using Chinese herbs. Right. So this is how we use it. If you use Chinese herb according to the feedback from patient, we find out the information. We ask by asking question. But now this stage, I actually more using other method. It's just using pulse. I then ask more question according to the patient give me the information, and I prescribe the herbs. I actually using pulse and to decide what herbs they need. That's first thing. The second thing that I use pulse as well as giving the acupuncture point. Okay, so sometimes those points works very well, but if that doesn't work well, I go with pulse. And many with pulse, if those points can balance the pulse as well, and they are good point too. Okay, hi, happy day, how are you? Okay, now let's talk about, so have you got your pen and paper ready? We're going to talk about a point now, acupuncture point. Have you got the paper and pen ready? If you haven't, you better go now and get ready, because I'm going to start, and we're not going to stop that. I will repeat that if you wanted to. Are you all ready? Will you post it in the group? Yes, I will. Stagnation, yes. Yes, it makes sense, thank you. That's great, thank you. Now, any of you are ready? Yes, I can post this in the group, no problem at all. I actually posted this one already. OBGYN. I'm going to, if you're an acupuncturist, we I just did a live video on our acupuncture group. Yes, I'm going to post on the Facebook, only on the group. Okay. Happy day. And the Tai Yin Yang Ming, I just did it in Chinese yesterday in the group, and I'm going to do it in the English group probably tomorrow or today. I'll see. Okay. Right. Have you got a pen and paper ready? Let's start. When it comes to PCOS, right? We all know it's a hormone imbalance. So, balance method acupuncture. Okay, cool. Thank you. So, in balance method acupuncture, we have local balance and global balance, right? So, when we treat internal disease, hormone disease, we use global balance all the time, right? Then this is the strategy, the first strategy that I want to show you. It's actually female hormone balance. Now we also call it heart spleen sao yang. Heart spleen sao yang. There you go. Heart spleen sao yang. Put on that as well. There's another camera in here. Alright. So over here, on your right side, you needle heart 4 and heart 1. Sorry. Is on your right side. Hang on. On your left side. Sorry. My bad. On your left side, you needle heart 3 and heart 7. And on the left side again, you needle GB 34 and 41. GB 34 and 41. On your right side, you needle Sanjiao 1 and 4 and spleen 1 and 4. Okay, I'm right. Spleen 1 and 4, Sanjiao 1 and 4. So this is just for hormone balance. Okay, hormone balance, a great thing for hormone balance. So it can treat hormone imbalance, emotional, forgetful, low abdominal cramp, bloated, okay, sleeping disorder, irregular bleeding. So it mainly treats PCOS that causing hormone imbalance, right? So the heart 4-7 on the left side, GB 34 and 41 on the left side. You can put it on the right side. If you needle on the right side, then the Sanjiao 1-4 and spleen 1-4, you needle on the left side. You can swap them. Does that make sense? Okay. Now this is one of the strategy. Point strategy. And the other strategy is Dr. Tan's 8 Magical for OBGYN. Now remember, we introduced this in what? We talked about this in the others, fibroid. Now OBGYN means any kind of woman issues, you can use this strategy. Okay. Now, in this strategy, it includes the heart spleen sao yang meridian, but the point is different. Heart spleen sao yang. Okay. The point is different, but it actually includes the point, the meridian, right? So OBGYN, medical aid for OBGYN, it has heart, spleen, sao yang, which is Sanjiao and GB. And what else? It got Yang-Ming, which is KP Yang-Ming, kidney, pericardium. Yang-Ming is last intestine is stomach. KP Yang-Ming, and heart, spleen, Saoyang, and it become 8 meridians. Then there's 16 point on your right side. You have Sanjiao 1-4 and large intestine 1-4, spleen 1-4, kidney 1-4. You see, spleen 1-4, kidney 1-4. Then on your left side, heart 3-7, PC 6 and 9, PC 6 and 9, heart 3-7, and GB 34-41, GB 34-41, stomach 45-42, stomach 45-42. So in this, actually based on female hormone balance, right? 8 points of this plus kidney KP Yang-Ming, right? Plus KP Yang-Ming, which is kidney and pericardium Yang-Ming. Okay, simple, right? Very simple. 16 points that can treat all the PCOS problem, balance the hormones, and treat the other symptoms. Okay, treat the other symptoms. Right, that's it. Pretty simple. Now, apart from those, what else can you do? Can you needle tummy? Yes, you can needle tummy point. Remember, the groin point is quite important. So when I needle groin point, I don't actually retain the needle. I just quick needle, go in, stimulate the point, and needle out. That's it. And then I mainly I may do some needle retaining in the tummy. Okay. Now there are a lot of points on the groin, which is, sorry, I don't know about the English code. But I know about the Chinese one. So 阴连、足五里、极脉、冲门、辐射, all this point are very good for PCOS. And you can do 归来子宫 uterus point, 水道、气海、关元、中极、横骨、曲骨. All this point around the tummy, lower abdominal, are good for PCOS. Apart from here, you can do 八疗 as well. We have some master only do 八疗. They don't do distal point. They don't do this. You know, some master some acupuncture master, they only do tummy point or 八疗 point to treat all the woman problem, to treat PCOS. So yeah, you can do 八疗 point as well. Okay, simple, right? So what? Bear in mind, when it comes to acupuncture and Chinese medicines for PCOS, don't just rely on acupuncture and Chinese medicine. If the patient do the exercise, change the diet, they lose weight quick, and when they lose weight, their hormone get better, and they get regular period, then everything will start to go back to normal, right? It's just balancing the hormone is important, and losing weight is important. That's why I show you that how to balance the hormones and how to lose weight strategy. That's many on the diet. Okay. Stay awesome, and I think we will finish in here today, and I'll see you tomorrow, guys, and thank you for being here and supporting me. And remember to give me a thumbs up if you think this is valuable, and this is a good live video, that you enjoy it, and as well as share this live video, please. Thank you very much. Rika say thank you for sharing all your knowledge and valuable experience. Have a great day. Thank you very much. Okay, that's it. I'll see you tomorrow. Stay awesome. Have a great day.